Healthcare systems very jealously have been protected as a subsidiarity issue from the national governments, but they have to be adequate to respond to this demographic crisis, to aging population, to the migration of healthcare professionals and aging also of the healthcare professionals.
The problem statement is clear. We're going to face a situation where we have many more old people requiring much more care, and we're seeing a decrease in number of people providing that care.
What is clearly important in this sector, more than certainly in any other sector, is to integrate those healthcare professionals in the different levels of decision taking. And at the moment, we feel some, dissatisfaction.
The healthcare system should be prepared to have the best service for and care for elderly people. This is a challenge that so far I think we are not ready to face.
To sustain a level of quality of care, it's unavoidable that we'll need information technologies to keep the productivity also up of the providers of that care.
We need a paradigm shift from acute care to long-term care. I mean, there will be an increase of chronic diseases that really require engagement from patients, providers, healthcare professionals, and friends and family. And for this help, for this shift from the hospital to the home, which is where care needs to be given, healthcare technology or health IT and ICT technologies is actually very, very much adequate.
We think that ICT is not only about cost saving, it's also about providing better care to patients. So it's reducing patient error, it's about providing the environments where people can live independently much longer, get their care at home, so avoiding long stays in hospitals. So ICT is much more than just providing care at a lower cost.
If we are prepared and if we are doing with a good organization, good management tools and especially evidence-based, it doesn't cost lots of money.
It might not require new money. It might be the existing money, but applied on a better and more certain way and more focused way.
Good examples are at regional level. There seems to be a size factor in not in terms of population so much, but in the way a system can change and integrate things. So the good examples we find today are more in rather middle-sized or low-sized countries or even regions.
There are big investments in political will, leadership. There are big investments in organizational changes. So it's not so much the finances. It's much more the change in the heads of all of the actors, the insurers, the care providers, the politicians, the patients, is how to interact among these different groups and what the technology can do to facilitate that.
What is the grain of sand on the wheel, let's say, is actually, the usual slowness of the system on matching on the new configuration the pieces of the puzzle. So time, we'll say, an increase of awareness we will also bring, but we are sure that altogether we can move this forward because technology is definitely ripe to be set in place.